Welcome back to Summarize Science. Surgical robots are amazing tools, but they have a surprising blind spot. They can't really see their own bodies or the world around them. This lack of spatial awareness can lead to collisions and disruptions in the operating room. A big part of the problem is that for sterility, these robots have to be completely covered in drapes, making them nearly invisible to cameras. Currently, surgeons use bulky infrared cameras that track a few reflective markers placed on the robot. But these are easily blocked, expensive, and add more clutter to an already crowded room. Now, a team of researchers has developed a groundbreaking new way to track robots, even under the drape. They call it proprioception, essentially giving the robot a sense of its own body in space. Instead of special markers, their system uses simple, lightweight stereo cameras, like a sophisticated webcam, combined with powerful AI. This AI has been trained on over 1 million images to recognize the robot's shape or silhouette right through the sterile drapes. The system then digitally overlays a 3D model of the robot onto the camera feed and adjusts it until it perfectly matches the robot's real position. They tested this during a simulated spine surgery, a procedure that requires incredible precision. Their system was not only much smaller and less intrusive, but it also improved the visibility of the surgical area by 25% compared to the old method. Amazingly, it was so precise that it could track and compensate for the tiny movements of the spine caused by the patient's breathing. In fact, it revealed subtle tissue movements during drilling that the standard infrared systems completely missed. This suggests that current methods might not be capturing the full picture of what's happening to the patient's body during surgery. The AI was even effective in a more complex setup with multiple robots, which is the future of robotic surgery. It learned to ignore obstructions like cables, tools, and even the surgical team's hands. How accurate was it? From over 8 feet away, the system could locate the base of the robot with an error of less than 4 millimeters. That's an accuracy of over 99.8%. Even at the robot's tool tip, moving through complex motions, the error was only about 1.6 centimeters. So, to recap, researchers have created a system that uses standard cameras and AI to see and track surgical robots right through their sterile drapes. This method is smaller, less obtrusive, and in some ways, provides a more detailed view of the surgical field than current multi-million-dollar systems. It's a huge step toward making robotic surgery safer and more efficient. What does this mean for the future? Imagine operating rooms where multiple robotic arms work together seamlessly, fully aware of each other and their environment. This technology paves the way for smarter, more autonomous surgical systems that can assist surgeons in ways we're only just beginning to imagine. Thanks for watching Summarize Science.